Thank you very much for your patience and a warm welcome from the Office of Community Services. Thank you for joining us for Supercharging Performance Management with Rapid Cycle Learning Lab for the Community Services Block Grant. I'm Josetta Alexander, a CSBG Senior Advisor with the Office of Community Services. It is truly a pleasure to have each and every one of you with us today as we embark on a two-day interactive learning lab. Our second day of training will be on September 14th, which is this Thursday. The Learning Lab will provide the RPIC and CSBG state associations with the opportunity to gain knowledge about rapid cycle learning, or RCL, including what it is, when and why to use it, and how it can supplement the results-oriented management and accountability system, or ROMA. Using examples from the OCS Project Impact Grant, you will see rapid cycle learning in action and become familiar with the tools that can support CAAs in using rapid cycle learning to test, adapt, and/or enhance innovative programs and service models to effectively respond to urgent community needs, which will also serve as a great resource for future RPIC grant recipients as you provide training and technical assistance to CSBG eligible entities to support the needs of low-income individuals and families. We hope that you will leave energized to support the CSBG network in using this method. Next slide. Today's agenda includes an overview of Project Impact, an overview of rapid cycle learning. As mentioned earlier, the overview will include what RCL is and when and why to use it. And finally, we'll close out today with the capabilities that RCL supports, as well as an interactive breakout room. On Thursday, we'll take a deep dive into RCL and also have an interactive breakout room. And we'll wrap up with a reflection on all that we have learned. Today's presenters include our wonderful leader, Cherise Johnson, the Director of the Division of Community Assistance. In a moment, Cherise will walk us through an overview of Project Impact. We are also joined by the Mathematica team, Jeanette Holbrook, Rebecca Pyatt, who is sitting in today for Rachel, Annie Bonaspina, and Katie Edens. We also have Ronika Carr on the line. She has been a tremendous support in leading this project. Our goal is that by the end of today's Learning Lab, you will have a better understanding of what RCL is, when to use it, why to use it, and the organizational factors that support RCL. You will understand how RCL can supplement ROMA. You will become familiar with the tools that can support RCL, and you will understand the ways that RCL can benefit CAAs as well as other CSBG eligible entities that you support within your respective regions. And we hope that you will be inspired to spread the word about RCL throughout the CSBG network. We really hope that you enjoy this learning lab and find it to be a great resource as you move forward with RCL. Thank you. I will now turn it over to Cherise to provide an overview of Project Impact. Thank you.
Thank you, Josetta, and hello to everyone on the call today. I am so encouraged by seeing at least 44 participants on this call. I know some of them are state staff. I know some of them are OCS federal staff. I know some are from Mathematica, but by large, you all have shown up strong as RPICs and state associations to participate in this important conversation that we're getting ready to have. And I would ask that you open your minds and really celebrate what you're hearing, because it speaks to the hard work that happens in the field, the hard work that happens in communities where our eligible entities are carrying out the work of the Community Services Block Grant. We want to say thank you. Dr. Howard also sends her thank you and congratulations to all of the agencies that participated in Project Impact, but also thank you to you all for joining this call today, because we believe that transferring knowledge is paramount to grow the field, to learn from each other, and to really start to build evidence. So when we think about Project Impact, and we go to the next slide, we talk about the purposes of Project Impact. And what I want to say is that Project Impact was developed out of a crisis. But what I learned during this time is that through a crisis, unfortunately the pandemic, we were able to come together, and I'm talking about the community action agencies, the CSBG eligible entities, the states, and the community leaders at all levels to say, what can we do to remove the crisis, respond to the pandemic, to prevent people from not having access to valuable resources that they need? What can we do in our local agencies to really make a difference in our community while using the COVID dollars to help sponsor some of those changes that needed to happen and be responsive to the needs? It's amazing that even before we announced the opportunity for funding through Project Impact, many of the community action and eligible entities had already implemented strategies to respond to the needs as a result of the pandemic. And we were able to hear these stories from the field and think about how can we use our COVID-19 dollars to continue to build evidence, to continue to spotlight what's happening in communities that may be something that can be replicated. And that's how Project Impact evolved. It evolved out of the hard work that was happening in the pandemic. How can we learn from that and really build evidence on how to respond in crises, but also how you all were able to, how the states and the eligible entities were able to really work together to respond to the needs on the community level. If the community-based organizations had not already positioned themselves to respond to the needs based on the pandemic and to develop strong programs to meet the needs of the community, we may not have a Project Impact. So I just want to be clear that the Project Impact really evolved out of the hard work that was happening already. And then we were able to use some of that information to really build a body of evidence, questions, and really develop strategies that if you had another chance to implement that strategy, what would you do? And the nexus to the state associations as well as the RPICs is how do we take that information that was learned and transfer that knowledge as we continue to build evidence to support the CSBG network, and most importantly, support families and communities of need. The RPIC, the Project Impact project period was approximately 15 months. So we had grant recipients who were really brave to step out and say, we want to do this. They were selected and they entered into this journey for 15 months and came out with amazing results. And for that, we have to say thank you. And we also believe that it was a great opportunity as we move to the next slide to look at different aspects of what these RPIC grant recipients were doing. They were adapting service delivery to a physical distancing environment. You know, what happened as a result of that? Coordinating with public health. We know that partnerships are so important in the community, in the CSBG network, and partnerships are important at all levels. What are some creative things that we learned? Identifying training for high demand jobs. We know that the job industry changed and needs we're still trying to rebuild from those strategies that have changed or to meet the needs for people who may be unemployed. We're still working on that, but that was something that communities picked up on. We also know that making structural reforms at the community level, you know, how do you really think about how you coordinate services? How do you think about how do you, leverage resources and efforts to be able to change conditions in the community, and strengthening individual and family adaptive capacities, helping families. And we know sometimes families that are impacted by low incomes need additional help. And how can we do that strategically? How can we do that to build evidence on how to implement something that's strong to get the results? And all of these different areas in which the rapid cycle grant recipients fall is a way to show a holistic way to wrap around families, to leverage resources for the community, to establish great partnerships, to identify what the needs, whether it's jobs or food insecurity or whatever, and to really put strategies in place to address those community level needs. And we are really pleased with what we were able to accomplish as a result of this. As you can see, Project Impact was across the country. You can see, and you possibly will recognize some of these agencies because they are in your region. State associations and RPICs are in your state or in your community. You will recognize who these are. And you all, as relates to the state associations as well as the RPICs, the regional convening, you have probably stakes in some of the work that has gone on. We just don't know it yet. But we do know that there's a large portion of the country that is not covered. And one way to be able to transfer the knowledge that was learned as a result of these projects is to how do we use our state associations and how do we take full advantage of the regional convenings in order to spread this information. It builds evidence, it builds on what we're already doing, and it really, hopefully it'll be a good strategy in which we are looking at our return on investment, and we're seeing where we're going to take this information that we've learned from this small cohort of grant recipients and how we're going to spread that knowledge across the country. So I hope that gives you a little perspective of what we hope to accomplish. I hope that gives you a little perspective that we're trying to put tools in the toolbox for our state associations and our RPICs to use to allow us to continue to build evidence. And how can we use what we learn once these strategies are part of your training and technical assistant approaches, how we can use that as a beginning of building evidence together to improve how we meet the needs of families and communities. Next slide. So OCS's vision for rapid cycle learning is really to build another side of the brain, really to be able to build knowledge, really to transfer knowledge, to learn from each other, and that we can replicate. So you can see we want to demonstrate the significance of innovation. And if you have heard Dr. Howard speak, that is a huge part. How do we design and how do we build opportunities to do new things, think differently, take advantage of what the field has to offer? And rapid cycle learning is not new to ACF, but it was new to what we were doing in the Office of Community Services, specifically regarding the Community Services Block Grant. And we wanted to take ROMA to a different level. We wanted to move us to really looking at strategies that can really support reaching outcomes. And we wanted to use innovation and the resources that we had to do that. And I think we have been successful in meeting that part of our vision. We wanted to support continuous quality improvement, because continuous quality improvement is paramount to us doing work smarter, to taking advantage from the best knowledge that's out there, and making sure that we create a culture of curiosity in regards to what else can we do in order to improve our resources and our reach. What else can we do to improve technical assistance? And also to build off of the technical assistance survey that was done. And that is to make sure that continuous quality improvement or continuous improvement is always a part of our learning and teaching, as a part of our training and technical assistance learning agenda, and also our responsibility in regards to the federal office in making sure that we have a culture of curiosity in which we're always looking for different ways to improve the work we do. And then finally, to develop promising practices to build knowledge in the network. I've said that before, I'll say it again. The premise of transfer of knowledge was huge as we presented this opportunity to our leadership to get the go-ahead to move forward with Project Impact. And then finally, to support community action agencies to strengthen and enhance the work that they're doing. And that was important because some of the grant recipients talked about that, they often test strategies, and you'll hear more about that in a few minutes. So I don't want to talk too much about that, but how they want to do better, how they want to be able to reach more people, how they want to get staff engaged, how they want to make sure that the work they're doing has an impact at the community level for families that need us the most. So it's really about how can we organize, develop and organize and implement strategies to make a difference. How do we track along the way to see if we're heading toward the outcomes we hope to reach? And then after we do that, how do we transfer that knowledge to the network? And in this case, it's the state associations and the RPICs to transfer that knowledge so that we can continue to build on what we've learned. We continue to benefit from the investment that was made for Project Impact, and that we're able to also show how through good technical assistance, which you all are going to provide after you finish participating in this training, how can good technical assistance and resources based on a body of evidence really make a difference in the CSBG network? So I hope hope you understand why we're doing this and why we actually implemented our rapid cycle learning, how Project Impact was a success in regards to the work involved in building out strategies and implementing strategies that can make a difference, and then how you can take the information that you're learning today and Thursday in regards to building your repertoire and putting tools in your toolkit as state associations and RPICs to really spread this knowledge across all of the network. I'm excited about this. I think it's a grand opportunity, and I can't wait to hear more about how successful you all are in using these strategies to build strong programs that make a difference for families. And without further delay, I'm going to turn it over to my mathematical colleague, Annie.
Thank you so much, Cherise. Appreciate that intro. So I'm just going to start with a brief introduction into what rapid cycle learning is and how it can supplement current performance management processes that agencies are using. But before we get right into the information, we want to start with just a few questions to get a sense for your familiarity with rapid cycle learning. So we're going into this learning session assuming that many of you have not heard about rapid cycle learning yet. So if you haven't, that's totally fine. If you are familiar, though, we would love to know that at the start, because we would be interested in hearing from some of you about your experiences over the next few days. And we'll have some sharing opportunities throughout this 2-day session. So Derek, if we can start there with launching our poll. Our first question is, how familiar are you with rapid cycle learning? And your options that you should see pop up are, this is the first time I've heard of it. I've heard of it, but I don't know very much. I've tried it and I'm still learning, or I'm very familiar with rapid cycle learning. So I'll give everyone just a little bit longer to answer that question. Looks like responses are slowing down, but we'll give about 10 more seconds. Okay. And we'll share the results. So it looks like the vast majority of you have at least heard of rapid cycle learning, but don't know much about it. So like I said, that's fine. We'll be starting kind of from the beginning with some introductory information about what rapid cycle learning is and how you would engage with it. So this is good to know. And for the small number of you who are very familiar with rapid cycle learning, please keep that in mind when we have our sharing opportunities, because I think it would be great to hear from some of you about how you've used it in the past. So with that, thank you for responding to the poll. We just have one more open chat question, which you can see on the slide, which is just, like I said, if you could respond in the chat, what's one hope you have for the session today and Thursday? What's one thing you'd like to get out of today's session? So I'll give some time for people to respond to that. How to best support ROMA in my state with rapid cycle learning. And that's definitely something we'll be touching on today. Obtain new resources. Yeah, so as Cherise had mentioned, we're very excited to share with you 2 tools in particular, one today and one Thursday, which we hope is helpful to you as you're supporting CAAs with this. Knowledge and practical uses, some examples of simple ways to use rapid cycle learning, understanding, lots of interest in how it connects to ROMA. So like I said, we'll speak to that pretty soon. So good to see that a lot of you are interested in that. So I think with that, thank you everyone for responding. To stay on track with time, we will move on, but I'll just read this last one. I think rapid cycle learning is an evaluation technique, but I think it can be useful throughout the ROMA cycle. So yeah, again, a lot of interest in how this complements the ROMA cycle. So we will be sure to touch on that today. Thank you, everyone. And Sarah, if we could go to the next slide. So rapid cycle learning, if you haven't heard of it, is a process that organizations can use to learn about and improve their programs in a short time frame. And there are a lot of methods or approaches that are considered under the umbrella of rapid cycle learning. So there may have been other terms you've heard of. Cherise spoke to continuous quality improvement. You may have heard of plan, do, study, act cycles, or pilot tests, or small experiments. These don't exactly describe the same things, but it gets at the same idea that you bring intentionality and systematic methods to your efforts to improve. So rapid cycle learning, as the name suggests, focuses on rapid program improvement. And when we say rapid, we mean that it's a process that can inform your day-to-day decisions as opposed to something like a traditional evaluation that often takes a little bit longer to produce insights, though of course still valuable for other purposes. But it doesn't necessarily mean when we say rapid cycle learning that every step happens quickly, but just that the process is quick enough that it can be used to inform real-time decision-making. It's also a process that is cyclical, as the name suggests. So you try out a new strategy, that might be something like a new tool or a revised process. You would pilot that with your team and your participants, and then you would refine your strategy based on what you learned and try it again, incorporating those refinements. And so likely most programs, most organizations are already going through the process of identifying challenges and trying strategies to address them. They probably do that on a day-to-day basis. I think what makes rapid cycle learning different is the intentionality and the use of those systematic methods that you would bring to the work. So you're intentional about learning about challenges before coming up with strategies. You're intentional about piloting those strategies on a small scale first, and really being systematic about collecting information and feedback to learn about how to make it work better before you roll it out to the whole program. So now we'll get into the key steps in the process. Really, regardless of what approach you're using, there are these common key steps to rapid cycle learning. As I mentioned, you would start by identifying a problem or a challenge to focus on. Then you would brainstorm possible improvement strategies to address that problem or challenge, and ideally choose one to start with to pilot. And then you try out your strategy with a small group and collect simple information or data about how that's working. And then you learn from your data. So you're trying to understand what happened, what do we need to do to make the strategy work better? And then finally, you would make decisions based on the data that you gathered. So we can get a little bit more concrete with an example. So let's say for our challenge, we noticed in our data that clients are not attending follow-up meetings with their case managers. Maybe we have some conversations with clients to learn a little bit more about that challenge. And we find that they often forget about their follow-up appointments. So for our strategy, we know now that it's not lack of motivation or lack of time, but the issue is forgetfulness. So we might consider text message reminders as a strategy to improve meeting attendance. So then we'll pilot that strategy. Say we'll try it out for 4 weeks, so on a small scale. We can collect some feedback from staff and clients on their experience and the feasibility of sending text messages with a goal to learn how to refine the strategy. We might also collect administrative data on appointment attendance to understand whether the strategy appears to be supporting success or not. And then we would review that information. So maybe we learned that staff found it to be feasible to send these text messages, but also felt like one text message maybe wasn't enough for every client. We might have learned from clients that they found these reminders helpful. And finally, our attendance data showed a positive trend with case management attendance. So for our evidence-informed decision, we decide we're going to pilot again, but this time we're going to try sending clients more than one text message, given the feedback that we received from our staff. And then after that second pilot test, we could continue to iterate and work through the steps in the cycle, or maybe we would choose to adopt the strategy at that point because we feel confident that it's working as intended. Next slide. So everyone was very interested in how this complements ROMA. So we do want to speak a bit to that. And thanks to the Community Action Partnership for this graphic that we're using here. So we know that agencies already have ROMA processes in place and wouldn't want to introduce something that conflicted with that. But we see these processes as very complementary to each other. And in fact, one TA provider noted to us that rapid cycle learning is like the small wheel that can help move the large wheel of ROMA. And I think that's a great way to think about it because it's not a duplicative process. RCL helps teams to address common sticking points that may come up in the performance management process, whether that's ROMA or another process. So you all know that ROMA is all about using data to make better decisions. The ROMA cycle, like the RCL cycle, has 5 steps, so it should feel somewhat familiar to practitioners. There's the assessment step. What does the data tell us about our community needs? Planning, which is about using data to identify outcomes and strategies. Implementation is executing on those strategies. Achieve results, which is collecting that data and reporting on progress. And then the evaluation step, which is about analyzing data and comparing it with benchmarks. And so there are several places where we feel rapid cycle learning can support practitioners. Just for example, as we present on the slide here, the planning stage, staff are trying out new innovations. Rapid cycle learning offers a process for trying out those innovative ideas on a small scale first. And that kind of provides a safety to fail if those innovations don't work as expected, because you're trying it out on a small scale anyway. And in fact, in Project Impact, many grant recipients actually use rapid cycle learning in this way to launch new innovative ideas. In the implementation stage, rapid cycle learning can help to uncover challenges that might get in the way of a successful strategy. So for example, a team that I was supporting was testing out a new process for client referrals. And they discovered through the process of piloting that a few staff weren't really motivated to try the new strategy and didn't understand the reason for the change. So if they weren't being intentional about learning how that new referral approach was working, they might just have not have identified staff motivation as an issue and just concluded that the strategy was a failure because it didn't support progress on goals. But instead, through piloting, they were able to uncover that barrier and address it so that they could make an accurate assessment about how that new client referral process was working. And then finally, in the results and evaluation steps, and I think someone spoke to this earlier, organizations are monitoring outcomes. I think a common issue at this step is that programs see that they're not achieving a priority outcome. So they recognize this as a challenge, but they don't really know how to go about improving on it. The early steps in the rapid cycle learning cycle emphasize breaking down high-level challenges to get at the root of challenges. So it offers a step-by-step process for investigating and addressing those challenges. So it's kind of like a roadmap for what steps to take when you see through your monitoring processes that you're not hitting a key benchmark. So there are opportunities at various steps in the ROMA cycle where we think rapid cycle learning can be helpful. But our main takeaway is that it's not something that replaces or conflicts with ROMA in any way, but it really supports it. So a team that gets really good at using rapid cycle learning and uses it consistently, we feel is a team that could get the most out of ROMA. So with that, I'm going to pass to Jeanette to talk more about the benefits of rapid cycle learning.
All right, thanks, Annie. So in addition to supporting ROMA, rapid cycle learning is a method that can help advance most program improvement efforts. So let's talk about how it does that. First, we use rapid cycle learning as a way to test out changes on a small scale. So think of it as improving implementation here. That's more of the focus than, say, like establishing causality the way that we might in an evaluation. So we're testing out changes on a small scale, and this makes change more manageable. And it creates greater safety for an idea or a change to fail. And failure is not a dirty word in rapid cycle learning. It's an opportunity, it's a learning opportunity that helps teams feel safe to try new approaches and learn from mistakes. And using rapid cycle learning also means that you systematically seek, collect, and analyze information about your program improvement efforts. So this means you're better informed about what's happening and why. And you're not just relying on one or just a few people's perspectives about whether a change is going as planned or how to adjust. And by working through the systematic process, you take a more objective approach to learning and improving. And then, as I just alluded to in that last point, rapid cycle learning is inclusive. It encourages you to involve anyone affected by a change throughout the improvement process. So you might wonder, why bother with rapid cycle learning? Well, there are a few benefits to your organization outside of the program improvement benefits I just talked about. So first, rapid cycle learning can help reduce change fatigue by creating the space and structure to implement and refine a strategy on a small scale. And then by collecting feedback and analyzing it quickly, we can improve the implementation of a strategy and how it fits the environment. So it can almost help prepare you for evaluation in that it can actually help you kind of refine the intervention, refine and define the intervention that you later want to evaluate. And I also mentioned RCL, rapid cycle learning, is an inclusive process. So including people affected by the change in the improvement process facilitates and promotes buy-in among staff, since staff voices are really the guideposts to the direction that the strategy ultimately goes. And then by giving teams the safety to try new things and fail, it encourages innovation, which can help improve programs and service delivery models. But let's spend a second to think about why this matters. So think about rapid cycle learning as a philosophy that can really guide how an organization operates. So getting good at learning makes your organization stronger and more resilient. And this is just to say, rarely does anyone get something perfect on their first try, which is why using a systematic iterative process can be so valuable. A really quick example, WD-40, that stuff that you spray on your squeaky door hinge. It has its name because it was the 40th formula they tested. The first 39, water displacement, that's a WD form, that's what the WD stands for. The first 39 formulas failed, but with each attempt, they learned and adjusted. And organizations that are the most successful ones are really good at using data to make smart decisions. They can quickly figure out what's working, what's not working, and why. And they can direct the resources that they have into changes that will make the biggest impact for the biggest difference for the people they serve. All right, so you've heard a lot of reasons about why rapid cycle learning has the potential to be valuable for this broader network of organizations that you support. So we'd like for you to reflect on what you've heard so far. So Derek, if you can please pull up the poll. The first question is going to appear as a pop-up. So what do you think is the most important benefit of rapid cycle learning? And I think you should be able to, oh no, you're only able to select one. So you might think more than one of these things, but just select the one that sort of resonates most with you. Is it that it supports ROMA at multiple points? It supports stronger planning with ROMA, stronger implementation with ROMA, it supports stronger achievement of results and evaluation with ROMA. Is it that it gives teams a safe environment to fail and learn, incorporate systematic information into program improvement decisions, or supporting inclusive improvement? So give folks a moment to kind of make your choice here. Sorry to make you choose just one. Hopefully you have multiple things are resonating with you. All right, about 10 more seconds. All right, let's go ahead and stop there. Okay, so some variation here, but it seems like the sort of most commonly answered was it provides teams with a safe environment to fail and learn. Supported or followed closely by it supports ROMA at multiple points, with a few others identifying some of the other response options there. And that's awesome. Thank you so much for doing that. So now in the chat, love for you to share some ideas about the challenges that organizations you support face that you think rapid cycle learning has the potential to address. So what challenges do they have where they could use rapid cycle learning to their benefit? So it'd be great for you to share some of your ideas in the chat. And if you're having trouble thinking of those, don't worry, we will have examples for you later. Paralysis by analysis, the ability to shift direction quickly, great. And also feel free to pop in the chat any questions that are coming up for you right now. What kind of data analysis activities could be most productive? I think we'll talk about that more on Thursday as we do our deep dive into rapid cycle learning then. Feel of failure and consequence, incorporating work with new Americans into the work of the agency with success. Great. All right, so keep those ideas coming, but we are going to keep it moving. Thank you so much for sharing those ideas. Now I'm going to share some examples with you from Project Impact. So these are examples of challenges that grant recipients tackled with rapid cycle learning during Project Impact. Many of these likely sound familiar. So they include staff or participant dissatisfaction with a service or a process, or inconsistent experiences, or there may be a lack of a process that staff really need to do their job well, or the processes that staff have don't work well. And then on the program delivery side, you can use rapid cycle learning to help tackle problems like low recruitment or engagement or low completion rates. This is not an exhaustive list, but it just gives you a taste of the kind of the different flavors of challenges that that give you some opportunities to use rapid cycle learning. All right, so we want to dig into some examples of rapid cycle learning in action. These are two examples from Project Impact. So the first focuses on a lack of supports for staff, and the second focuses on low participant recruitment or engagement. All right, so in our first example here, a community action agency needed more staff and volunteers to be appropriately trained on trauma-informed and harm reduction practices, because they had this community drop-in center that was just going gangbusters. I mean, it was really popular, and they needed staff to be able to have this training to support the work that they're doing there. So the strategy that the team developed was, we're going to have an onboarding system for staff and volunteers that includes trainings focused on trauma-informed and harm reduction practices. So the Community Action Agency they tested out this strategy, and they conducted staff interviews to understand the extent to which the onboarding system would develop. They felt like it would develop these trauma-informed practices and harm reduction skills. And they learned that staff felt it was important to focus on organizational core values, such as honoring everyone's right to live with dignity and treating people with respect during onboarding. So they said, hey, we have this idea, let's hear feedback. They did this in a systematic way, and they realized that they needed to refine the core values and draft this onboarding system to reflect staff feedback, and they implemented the system. So they adopted the strategy that they tested. And in this second example here in the blue, a grant recipient faced a challenge of low participant recruitment or engagement. So they had this weatherization training pathway, but enrollment was really low. That was their challenge. They couldn't figure out why. So they thought, maybe we just need to get the word out better. And they decided to test this strategy of conducting information sessions, recruitment sessions, so that they would increase awareness of the training pathway and enrollment into the training program. So as they did this, they tested out the strategy. They administered a survey before and after the information sessions, so that they could gauge changes in candidates' awareness of weatherization jobs and their interest in those jobs. And they also observed the sessions so that they could learn more about what was really happening in those, what were the experiences that candidates were having in these sessions. So they actually were surprised to learn that the candidates knew what the weatherization field was. They actually knew a lot more than the Community Action Agency expected. And so the team learned that awareness wasn't actually the issue. Instead, they realized that they needed to do a better job of advertising the weatherization job pathway. So it wasn't that people didn't know what it was, it's just that they weren't using quite the right words to trigger people to realize, oh yeah, that's what I'm looking for. So the Community Action Agency decided, based on this feedback, based on this information, to continue to hold the sessions, and they adapted advertisements of job pathways to include more information about weatherization, and they included the term weatherization in their home assessor job title and description. And so after making these tweaks, they tested their strategy again to make sure they addressed the real challenge, which was about how it was advertised. All right, so a couple of lessons learned here from the Project Impact grant recipients. So we've discussed some common challenges. Now let's talk about tips for success. And these come directly from the grant recipients that used rapid cycle learning. So the first tip for success is to focus small. Instead of jumping right to the biggest, toughest challenge, start small, and this can support incremental change over time, instead of looking for that silver bullet to solve your most complex challenge. And in some cases, grant recipients learn that small changes actually help them resolve bigger challenges. Another potential pitfall is overconfidence in a new strategy or being overly committed to it. It's easy to go into a process like rapid cycle learning feeling like you already know what you're going to find. Oh, I already know what they're going to say. But to be successful, you really need to go in with an improvement mindset, one where you're open to learning and changing, being willing to make tweaks based on feedback. And when I say tweaks, that it can include abandoning a strategy. That is an essential component of rapid cycle learning. The next one was seeking perfection. This is common. We can't do anything until we figure out how to do it completely perfectly. So decision paralysis. This is where teams don't want to move forward without figuring out everything at the start. Grant recipients I worked with definitely did this. And so what the problem is that makes them never end up moving forward, or it takes them so long to move forward. Instead, be willing to use rapid cycle learning to help you figure out some of those details as you go. It's okay to figure it out as you go. And then lastly, organizations are busy, staff are busy, so it can be easy to feel like you don't have the time to commit to rapid cycle learning. Identifying a champion for the work can help teams continue to use it. And I don't mean that that person is responsible for doing everything, just for helping the team create space and time for systematic improvement. So with that, I'm going to pass it to Rebecca.
Great, thanks, Jeanette. So now we're going to take a deeper dive into the organizational capacities that support rapid cycle learning and how to assess them. You can go to the next slide. So first, you might be asking, why is it helpful to assess an organization's capacities? CAAs and other CSBG eligible entities already have capacities to support learning and improvement, as you know, like their regular collection of data or review of data through their use of ROMA. And while they use RCL, they can continue to leverage their existing capacities, but they also might need to acquire some new ones, like adopting a more inclusive environment or obtaining staff and client feedback. So assessments can help teams understand their existing capacities and the capacities they need to grow to successfully undertake RCL. Working through an assessment helps teams understand a couple of things. First, where to focus their efforts to build their capacity. Second, what parts of the rapid cycle learning process to pay extra attention to. And third, if there are other perspectives, like let's say staff, clients, or partners that they can involve to increase their capacity to undertake rapid cycle learning. The Project Impact team developed a capacity assessment tool to guide reflection and consider priorities as teams get started with rapid cycle learning. The tool is based on work we did with the Project Impact grant recipients, which Sharice described earlier on in this presentation, and it will be publicly available on OCS's website later this year. So over the course of the next couple of slides, I'm going to walk you through the capacity assessment so you can understand how you can use the tool in your own organization or with CAAs and other CSBG eligible entities. And we'll actually get to dive deeper into the tool itself later today when we move into breakout rooms. Next slide. So we've started to establish that it could be helpful to use an assessment to understand a team's capacity to conduct RCL. And I've hinted that we already have an assessment ready for you to use. You might next be asking, when does it make sense to use it? So First, teams can use it when getting started with rapid cycle learning to help first understand your starting point, and to develop priorities for building an organization's learning capacities. Meaning it can be helpful for teams to understand what skills they already have in place and which ones they really want to focus on working on intentionally building. But the assessment doesn't need to be used just once. Instead, it can be used at regular intervals for teams to reflect on changes in their capacities over time. So in Project Impact, we asked teams to complete the assessment 3 times over the course of our project. At the beginning, to really assess those like early capacities, in the middle to see how they changed over time, and at the end of the project. It's also important to note that the tool that I'm going to show later, it's not meant to measure improvement in capacity objectively over time. So it's not a validated tool, and it is self-reported, meaning organizations will fill it out about their own capacities. However, we still think it's a useful diagnostic tool that teams can use to assess their own capacity changes over time and really think about their priorities. Next slide. So what's actually on the assessment? The assessment includes factors related to 4 domains, the 4 that you see on the slide. The first domain is organizational leadership and culture. So items under this domain gauge if leadership at the organization strive to build a learning culture, including making time for learning and improvement and modeling systematic decision-making. The second domain is rapid cycle learning infrastructure, or if the organization's tools, resources, routines, and processes enable staff to engage in rapid cycle learning to strengthen their services. Third domain is equitable improvement, meaning if the organization creates opportunities for staff, participants, partners, and others to engage in learning and improvement activities. And the fourth domain is human capital. This domain gauges if an organization has access to staff, either internal or external, with knowledge and skills to support rapid cycle learning. So some of these skills, which we'll delve into deeper later, include collecting systematic, quantitative, and qualitative information, analyzing this information, and sharing the results with interested parties in really accessible ways. Next slide. So how do teams complete the assessment? For each factor that I just showed on the assessment, it asks teams to rate their organization's capacity on a simple scale of early, transitional, or advanced. While completing an assessment, we recommend that organizations include staff with a range of perspectives, like both leadership and frontline staff in the conversation. If you can kind of decide how you want to utilize the assessment. So you might decide that team members complete the assessment individually and then compare answers, or maybe you want to complete the assessment as a group, engaging in group conversation over each of the ratings. The really key decision to make is making sure the assessment allows you to engage in honest reflection so that you can make it as accurate and helpful as possible. So who should complete this assessment? Just like anyone in the CSBG network can use rapid cycle learning, anyone can use this tool. So as you think about encouraging CAAs and other CSBG eligible entities to use rapid cycle learning, sharing this tool with them can be a helpful way to get started. Now I'm going to turn the presentation back to Jeanette to give some instructions on our breakout activity where you'll really get to delve into the tool.
All right, now for the fun part. We're going to give you an opportunity to get hands-on with the Rapid Cycle Learning Capacity Assessment tool, and we're going to spend probably around 25 minutes in breakout rooms, which we are assigning you to. So in each breakout room, your facilitator will first screen share the tool so that you can see what we've been talking about. And then each group is going to join a virtual collaboration platform called Mural, where each group is going to do a deep dive into a set of assessment factors. So we'll ask you to reflect on the assessment factors and to think about what the organizations you support do well, where they have challenges, and where they might need some capacity building. And your facilitator will share the link for you to join Mural, and they'll give you instructions on how to work in Mural for discussion as well. So then with that, I think we're about ready to go into breakout rooms. We'll come back probably a little after 2:25 just to wrap up. But if you've been multitasking, now is the time to focus on what we're doing so we can have a great conversation in the breakout rooms. So Derek, with that, I think we can go into breakout rooms. Okay, welcome back, everyone. Thank you so much. My group certainly had a lively discussion. I hope the other breakout rooms did as well. If you are, I think we're going to move on from sharing insights just for the sake of time to get everyone out of here on time. But we are, if you're curious about the other factors on the capacity assessment or what others were saying as part of their conversations, feel free to poke around the mural board, move around, see what others were talking about, what was on their mind. So feel free to continue exploring it. And before we conclude today, we did want to let you know what to expect for Thursday. So first, as you start to digest all of the information we've covered today, think about what questions you have. We're going to spend the first about 10 minutes of Thursday's session answering your questions. So please bring them, please share them with us, or be prepared to share them with us at the beginning of Thursday's session. A quick reminder, Thursday's session, you should have registered for that session separately. So we're going to put the link in the chat to register for that if you don't already have it on your calendar. I believe it is the same time as today's, but just on Thursday. So